Welcome, and thank you for joining us for part 2 of CDW Healthcare's podcast series on mobility management. In our last installment, we discussed mobility trends impacting healthcare, and today we're going to focus on special considerations for mobility management in today's healthcare environment. Here with us for this discussion once again are Vincent Vitale, he's the CIO of La Rabida Hospital, David Wright, an account executive for healthcare at AirWatch, and Stephanie Sult, a mobility solution architect at CDW Healthcare. And today I'd like us to begin by looking at the needs of healthcare organizations and how they differ when it comes to having a mobile management strategy. Stephanie, let's begin with you. What are your thoughts?
Yeah, definitely. Healthcare is very different from other verticals. One thing to keep in mind is that healthcare is under different security regulations, such as HIPAA or HITECH. You're also looking at securing PHI. You also need to take a look at not only the clinician mobile device and how that affects everything, but also the patient experience and how a mobile strategy can affect them and improve that patient experience, as well as not only striking a balance between IT maintaining a secure mobile environment, also the productivity of the actual clinician, because you don't want to limit their productivity during the day.
Vincent, what are your thoughts?
I would agree with Stephanie 100%. Not only is the patient experience from a marketing perspective important, but it's now being incorporated into our clinical quality measures. So patient satisfaction drives our clinical quality reporting, as well as driving our reimbursement in many cases. So we need to be conscious of that. We need to balance the patient experience with the need to secure the information and make sure that we're serving both needs equally well.
So, knowing healthcare is unique, how can mobility management support healthcare industry initiatives like meaningful use or EMR adoption? David, what are your thoughts on this?
Well, a big piece of mobility management, is more than just managing the asset itself. It's also application management. And if you're pushing an electronic medical records app down to the user, you want to make sure that they've got the right version, that it's updated regularly so that they have access to all of the features that they need. Now, your latest MDM providers are going to be able to push those applications, monitor the users that have each of them, and ensure that any users have the latest versions.
Stephanie, what's your take on this?
Sure. Having a mobile strategy in place, such as an MDM software, is only going to allow a better integration between the EMR and also any other type of meaningful use adoption. So at that point, you can do it one of two ways. You can have your clinicians VPN in on their mobile device, or you can have a native app that's actually pushed down to the device as well. So having that type of software in place only allows you to better streamline that process and getting set up.
Okay, Vincent, any thoughts from your perspective?
Well, from a meaningful use perspective, we are measured within many of the core measures, as well as the menu options, on our ability to capture certain data at certain times. By providing mobile devices to our workers, we're more likely and more apt to be able to capture that data, therefore scoring higher on our meaningful use measures. Recording things like problem lists, demographic information. Mobile technology can really enhance the capability to capture that data, to capture it on an efficient way. As far as EMR adoption, certainly mobile devices can help with our caregivers better accessing the information from where they're at and when they need to.
So then, in terms of other compliance, like meeting HIPAA requirements, what should a hospital's mobility management policy include? Vincent?
Well, certainly our mobility policy is being updated to include the access to information, the security and privacy of information, but also as to where that information lies and resides. Our general rule from a HIPAA perspective is to prevent data from residing locally on any device, if at all possible. And if it does reside on a device, then we need to use tools like encryption to make sure that if that data were lost or compromised, that the security of it and the confidentiality of it would be maintained.
That's great information. David, Stephanie, let me get you two to chime in.
To ensure that you're addressing HIPAA compliance, I think the two biggest things are monitoring passcode compliance and whether or not the device is accessing information are encrypted. Now, what you're able to do is, if you find that one of those two mandatory pieces of security aren't in place, restrict access to, let's say, email or content or applications or just all resources on the device as a whole. So, in my opinion, those are the two most important policies to have in place.
Also having the ability to remote wipe or even selective wipe a device. So a selective wipe would be when you have a BYOD device or personal device coming in and you only want to selective wipe off the hospital information. And then also you want to have a piece of your mobile use policy that contains a document and application management as well.
Well, we have time for one last question, and Vincent, this one is for you. How does La Rabida address the specific mobility needs of its different end user groups?
Well, we've defined 3 different groups within our mobility policies and procedures, 1 being our employed group, 2 being our contract group, and 3 being our general public. For the employed group, we can define what devices they're using, how they're using them, and whether or not we need to wipe them in case they're compromised. For the contract group, which is largely our physicians, we provide them with a broader range of support for different devices, but more limited access to information, as well as providing them with the capability to selectively wipe their devices. So not the entire thing, but just the partition where we store our own information if need be. For the public, we provide them with limited access to information, and we do not control their devices at all.
Terrific. Thank you. Well, that is all the time that we have for today. Our thanks to our speakers for joining us. Once again, Vincent Vitale, the CIO of La Rabida Hospital, David Wright, an account executive for healthcare at AirWatch, and Stephanie Sult, mobility solution architect at CDW Healthcare. And our thanks to you for joining us today. Be sure to be with us for our next podcast in this series, Putting Mobility Management to Work. Have a great day and log on to cdw.com/view for industry updates and to access this podcast series.